Hey guys, how are you doing? I know it's been a minute. It's been a really, really busy month, but I couldn't let October pass by without coming to talk to you guys about breast cancer. I don't know if you all know, but October is Breast Cancer Awareness Month. And today, what I really want to talk about are 10 different things that we can start doing today to lower our risk of breast cancer. Of course, we live in a world where, breast cancer, I don't think there's anyone right now that doesn't have someone that they know that is affected by breast cancer, either your sister, your friend, your mom, cousin. It's everywhere and it's increasing, unfortunately. And even though there is no one thing that we can pinpoint that actually causes breast cancer, there are things that we can do every day that can decrease our chances of being affected by this terrible disease. Thankful to science right now, there are a lot of different medications that are available to women or men with breast cancer, and the survival rate is, it's very higher than ever in history. But we still can. There's still things that we can do every day naturally that can reduce our chances of being affected by this horrible disease. All right, so let's get into it. All right, so number one is weight. Research has shown that being overweight increases your risk of being affected by breast cancer. So that's something that we definitely want to watch, and especially as you age, for women especially, maybe when you have children, we just tend to gain more weight. And so that's something we really want to be careful about, trying to do our part to keep our weight in check. And that brings me to number two, which is exercise. A lot of people, when we think about exercise, we think about, going to the gym and sweating and, carrying like 100 pounds, if that's even possible. But really, exercise is, they recommend 30 minutes a day for most days out of the week. They usually recommend 150 minutes a week. So that's like 30 minutes a day, 5 days a week. And this can be anything that you love to do. It can be gardening, it can be running after your children, running around with your children, going to the park, taking a brisk walk, just anything that you enjoy doing to just make sure that you're being active and keeping your blood moving and your heart pumping. That qualifies as exercise. So staying active is also another thing that can help us keep our weight in check. And the third thing is diet. I know we've heard this everywhere with all different types of diseases, that our diet is extremely important. I, for one, I personally believe that food is medicine, and what you eat can determine how well you're going to live your life. Okay, they usually recommend, fruits and vegetables. They're rich in antioxidants that can fight off any of these free radicals that can really cause damage to our body and just set things off. So you want to make sure that you're getting in your fruits and your vegetables every single day, and you're staying away from processed foods, starches, fast foods, things like that. Those are, these are simple things that we can do to reduce our chances of breast cancer. Another thing, smoking. Research has shown that women who smoke have a way higher chance of getting breast cancer. And so that's something that, if you already smoke, maybe you can speak with your pharmacist or someone that, or a counselor that can help you see how you can try to stop smoking, because research has definitely shown that women who never smoke have a lower risk of getting cancer, of breast cancer. And so if you already smoke, you definitely want to look into quitting, not just for breast cancer. There's so many diseases that smoking just affects. So that's something you really want to look at. All right, so the fifth thing on my list is breastfeeding. This is a little bit controversial. Some people don't want to breastfeed, and that's fine. But research has shown that women who breastfeed have a lower chance of getting breast cancer. So, if that's something that, I know I have 3 kids and I breastfed all of them, and I know it wasn't easy at all, especially at the beginning. But there's definitely benefit to it when it comes to breast cancer. All right, number six is birth control pills. Pills that we take to prevent us from getting pregnant. Research has shown that women over the age of 35 have a higher chance of getting breast cancer if they're on birth control pills. Of course, it's not just breast cancer. There's a higher risk of stroke and heart attack. Okay, if you're over 35 on your own birth control pills. Well, there's also benefits to taking birth control pills if you're over the age of 35, because research has also shown that if birth control pills reduces the chances of ovarian cancer, colon cancer, and uterine cancer. So I think this one is, it just depends. So for example, if a woman has a strong family history of breast cancer, and then you might want to think about, weigh the benefits and the risk and say, okay, I know this is going to prevent me from getting ovarian cancer. Well, not prevent, but lower my risk of getting ovarian cancer or uterine cancer. But because you have a strong family history of breast cancer, then that's a decision that you can make with your healthcare provider, and you guys can weigh the benefits against the risk. Okay. All right, so number 7 is going to be postmenopausal hormones. So these are hormones that you take when you're past you're past menopause, right? And so the research has shown that there's a higher breast cancer risk for women that take hormones post menopause. And so this is something that you definitely want to discuss with your healthcare provider. It shouldn't be taken for a very long time. It's not recommended. And so discuss this with your healthcare provider and see if there are other options for you. Okay. Number 8 on my list is early prevention. So I know, early prevention is not really something that we can do to reduce our risk of getting breast cancer, but it's so critical because, like I said at the beginning, there are so many different treatments right now out there for breast cancer. And so if research has shown that if it's caught early, there's a 99% chance that it's treatable. So they usually recommend mammogram. I know that it's a little controversial right now about mammogram, but they recommend mammograms every year for women over the age of 45. So between 45 and 54, they recommend yearly mammograms, okay? And then anything above 55, they recommend mammograms every other year. Some doctors are beginning to recommend mammograms if you're over the age of 40, but again, this is something you're going to want to discuss with your OB, if that's something that she wants you to do, I guess maybe depending on your family history, or things of that nature. Okay. All right. So number 9 on my list is cosmetics. Cosmetics, personal care products, cleaning products, things like that. They're currently doing research right now because they're suspecting 2 particular preservatives that are used in cosmetics, and those are the parabens and the phthalates. Okay, and I'm going to put it in the description. These 2 chemicals are endocrine disruptors. So what does that mean? They mimic estrogen, okay? And research, they're trying to figure out right now if this is something that can contribute to breast cancer, because these 2 chemicals are in almost every cosmetic out there in the market. Okay, if any cosmetic has like preservatives or anything like that, chances are they have these 2 chemicals in them. So for me, I'm a prevention kind of girl, okay? I prefer prevention. Why wait until they maybe 10 years or who knows how long from now, and they say, oh, this actually can, increases your chance of breast cancer, but then it's like 10 years and you're using all these products. So for me, prevention is key. Why, if it's suspected, don't use it. I, for one, am a big proponent of everything natural as much as you can, from what you eat to what you use on the body, because I've said this before, 60% of every single thing you put on your body goes into the bloodstream. That's how they do topical medications, and that's how those things work, is they go into your bloodstream and they can actually disrupt things. And so you definitely want to look at the things that you use on your body, your makeup, your you know, body lotions, your soaps, your cleaning supplies, things like that, and go as natural as possible, because you don't want to wait, because a lot of these chemicals are cumulative, right? And so if you use it one time, you might not cause it, but over time it accumulates in the body, and a lot of them are fat soluble, and so it basically just lodges and deposits in the fat tissues in your body, and it just stays there for years. So we don't really know how much of anything can cause anything, but I always believe in prevention, and to use natural products as much as possible. The last thing on my list, number 10, is going to be vitamin D. And a lot of, this is something that's really overlooked, because usually when you go for your yearly checks, they don't really check your vitamin D, right? They check like your blood and things like that. And so that's something I want to recommend. When you go to the doctor, make sure that you're checking your vitamin D levels, because research has shown that vitamin D is critical. I mean, there's no disease right now that vitamin D doesn't touch, literally. And research has actually shown that women that have low vitamin D have a greater chance of getting breast cancer. Okay, and so that's something that you want to check. And there are different sources of vitamin D. I like natural, and so things like your fish, your salmon, your mackerel, those things have natural vitamin D in them. If you try to incorporate that in your diet as much as possible. I know also cod liver oil, if you take like a teaspoon of 1 to 3 teaspoons a day, should also satisfy your requirement, your daily requirement for vitamin D. Kind of tastes nasty, but it does the job. So just try to do it as natural as possible, and to try to supplement your vitamin D. So, I hope this has been really helpful. I know it was a long video. I came in here, I was like, it's going to be 5 minutes, and, but I really hope that this really helps someone, and in helping us in reduce, at least, lower the risk of getting affected by this disease. All right, again, my name is Asa, and I'm a public health pharmacist and founder of the Asa Therapeutics Herbal Skincare. And thank you for watching. See you next time. Bye.